Hi there, it's Dr. Doug Willen. It's March 27th, and this is a short update today because I went in early to work. I live in Brooklyn, part of New York City, but I work in Manhattan. So I took my bicycle in to avoid the subway, and it was really eerie this morning how empty it was. I got to work probably by 7 a.m. to the office, opened up. Uh, just as short as a few weeks ago, I had staff and people, and I was all by myself today. The building is semi locked up, where I have to go downstairs 4 flights and let someone in one at a time. Had just a few serious cases. The elevator was working, so that's good, but had a few serious cases of sciatica and one with what people call a pinched nerve in the neck with radicular pain down the arm, numbness in the fingers. And these are all cases of people that didn't want to go to the emergency room because emergency rooms are completely overburdened, and they didn't, the word was that they might have to wait 6 or 8 hours to even see a doctor. So they came in to see me, and I was able to do a good enough job to alleviate some of their pain, give them some ideas of what to do, some home instruction, and take off the edge off of what was happening for them. I don't know whether we'll be open next week. We should be open up to March 31st, which is Tuesday. Beyond that, I don't really know. Doing my best to just serve a little bit as I can. So I just got home a little while ago, and it's almost 6 p.m. here. So I'm just going to put a little something down. 590,000 cases, and this was updated today, March 27th. So we're pretty close on this. I mean, you might say in the comment the number just broke 600,000, but as far as the last hour, it was 590,000 cases worldwide, 26,000 deaths globally. And I like pulling up this chart because, hold on, let me move this a little bit. Collapse that a little. Sorry about that. Okay, so I like pulling up this chart because it kind of gives us an update of the United States, where the place I'm living in, and that's trying to keep my vlog to stuff I know about, which is where I live, as opposed to I don't know exactly what it feels like to be in China right now. I haven't been in China in 30 years. But the United States just surged from 2 days ago being the third country with the third most cases. And what's interesting is Italy and the United States leapfrogged to position 1 and 2 for the most cases. So you can see here the United States has 100,392 cases, Italy 86,498, and yesterday Italy was at 80,000, and 2 days ago, the United States was around 70,000. Now, this has a lot to do with the availability of testing for the United States. For Italy, it has to do with the course of their trajectory that they've been on for a while. But the U.S. now, we're testing much more frequently. I don't remember the exact number, and I don't have that stat in front of me, but I think New York City alone is testing around 16 to 18,000 people a day. So, of course, that's going to drive those numbers up of data that probably was always there for the United States and where I live in New York. But without the testing, we don't really know how poorly we stand. And so what was suspected was that the United States was standing it was much more severe as far as total number of infected cases. And I think it's more severe than just this. So as today we move into the number one country with the number one infections, actually we moved in there yesterday, I think the number is going to just now completely increase exponentially. So let's look at some of the other things here. I'm looking at that top chart where it says 14,957 new cases in the U.S. Total deaths, 1,543. New deaths, 248. As we slide over, you'll see, and I bumped this out on the side here, look on the top right, but 303 is the amount of cases per million here in the United States. So for every million people, Right now there's 303 cases. If we drop just to yesterday, that number was 258. But look what's happening in Spain. Spain is moving, first of all, they have so many more people per million. Now, they're a smaller country population-wise, but look at the percentage of people that are infected. And look at their deaths. Their deaths are in the last column, 93 deaths per million yesterday, and today 106 deaths per million. Their new deaths has been just going off the chart, jumping up, and they are in a lot of trouble. And they are panicking, and they don't have the equipment either. Nobody has enough equipment to handle what's happening. And what is it going to look like in 2 weeks? I found a way to create this chart. This is where I live, the state of New York. There's 44,000 cases. And new cases, as you could see, total deaths, and new deaths. So we're starting to really create numbers that are frightening. And I think that number is just going to keep going. Our mayor of New York City, Mayor Bill de Blasio, tweeted this morning, well, I guess it was around lunchtime today, that 20 trucks are on the road with protective equipment for our medical workers, 1 million surgical masks, 200,000 of the N95 masks, face shields. I've been reusing a mask, trying to keep it clean, doing the best I can, but we're everybody's short on everything. And like I said, I'm not even in that part of medicine. I'm just working with people with chronic pain. But it's just it's a tough situation. One thing I did want to point out, which I looked at an article in the New York Times this morning. What was interesting to me is that doctors find the coronavirus affects some patients in subtle and unexpected ways. So we all know that you can have fever, shortness of breath, cough. A couple of videos ago, I did loss of sense of taste or smell as something to look out for. I like checking my temperature every morning. I didn't show it to you today, but it was 97.2. So I run a little low. And knowing that, I can tell when I'm running a fever, because for Fahrenheit, anything 1.4, 1.5 degrees above your normal body average is possibly in the land of fever. For Celsius, if you're 1 degree higher in Celsius than what you know to be your normal average. See, because 98.6 is thought to be the normal average in Fahrenheit and 37 degrees in Celsius. But let's say in Celsius you average 36 degrees, and then you're 1 degree higher. That would be average. You wouldn't think you had a fever. So it's good to know what your real number is, what your personal average is, and then you can start to keep an eye on whether you're starting to get into that area of fever. So what this point of that last slide I brought up was that we know that the coronavirus mostly infects the lungs. And in serious or fatal cases, it can cause pneumonia. Like I said, people have fever, cough, difficulty breathing. Recently in Brooklyn, which is the part of New York City that I live in, they had a patient arrive at the hospital with what looked like a heart attack. But on closer look, they realized, it was a cardiac arrest. It was expressing itself as a heart attack, but the underlying cause was the coronavirus. So the heart attack, what triggered the heart attack was acute myocarditis, a severe inflammation of the heart. And we've seen this before in other type of viruses, for example, MERS and the swine flu. So coronavirus infections, it can be literally deadly to people with cardiovascular disease, with horrible chronic heart disease situation, where they become a much higher percentage of people that are going to have a severe case. That included with autoimmune diseases, diabetes, as I said, heart disease, cancer. You're going to be much more vulnerable to having a severe case. So short one today, but thank you for checking this out. Leave a comment below if you'd like. And tomorrow's I'll be home. I'm not going into the office tomorrow, so I'll have time to maybe dig a little deeper and come up with something more educational. Thank you.